What impact does posterior placenta have on labor and delivery?
Hello and welcome. Today we'll be exploring a topic that's important for expectant parents: understanding the placenta's position and its potential effects on labor and delivery. Specifically, we'll be discussing the posterior placenta.
What is a posterior placenta?
To begin, let's clarify what we mean by a posterior placenta. The term posterior describes the position of the placenta within the uterus. When the placenta attaches to the back wall of the uterus, facing the mother's spinal column, this is known as a posterior placenta. This is one of the most common placements for the placenta and is generally considered normal.
How does posterior placenta affect pregnancy?
The location of the placenta can vary and doesn't typically have a significant impact on the pregnancy. A posterior placenta does not usually cause complications or symptoms. However, with a posterior placenta, mothers might feel their baby's movements more strongly and earlier in the pregnancy, because there's less cushioning between the baby and the mother's abdomen.
What impact does posterior placenta have on labor and delivery?
When it comes to labor and delivery, a posterior placenta generally does not present difficulties. The placenta's position doesn't affect the baby's position, and most babies will turn to the anterior position, facing towards the mother's back, which is typically ideal for a smooth labor and delivery. It's important to note that any potential complications aren't usually due to the placenta's location, but rather its movement. For instance, if the placenta moves too low, placenta previa, or detaches prematurely, placental abruption, this can lead to complications. But these issues aren't specific to a posterior placenta. In conclusion, a posterior placenta is a common, normal placement for the placenta. It doesn't generally affect the course of the pregnancy or delivery. Remember, each pregnancy is unique, and while this information is generally true for most, you should always consult with your healthcare provider for advice specific to your situation. Thanks for watching, and we hope this video has been helpful in understanding more about the role and impact of a posterior placenta in labor and delivery.